Hi, everyone. Welcome to another Orthopod. This morning, we have a very interesting discussion about an alliance and also a somewhat breaking news statement that we're going to hear. Let me welcome, first of all, Professor and Chairman, past President of the European Federation of National Associations of Orthopedics and Traumatology, Professor ONDER AYDINGOZ. How are you, my friend?
Thanks, Mohit. Thank you very much for the kind invitation.
So let me start off, ONDER. What is the Alliance of International Organizations of Orthopedics and Traumatology?
Mohit, it is a platform of international organizations of orthopedics and traumatology. The members are APOA, which is Asia Pacific Orthopedic Association, EFORT, which is European Federation of National Associations of Orthopedics and Traumatology, Pan-Arab Orthopedic Association, CICOT, and SLAUT, which is Latin American Society of Orthopedics and Traumatology.
When you talk about size, what number of surgeons do these 5 orthopedic associations represent around the world?
The members of the organizations are various. I mean, when we are talking about APOA, it has 65,000 members from 25 countries, actually. EFORT has 45,000 members from 39 countries in Europe. Pan-Arab Orthopedic Association represents 21 countries, like with 10,000 members. And Latin American Orthopedics and Traumatology Society represents, again, 21 countries, like 40,000 members. CICOT is a global organization, as you know, but the other 4, they are actually federations. They have federation models. APOA has a hybrid federation, the others are full federations. So there isn't any individual membership to those 4 organizations, but the members of the member organizations are represented here.
Yeah, so it's sort of like each of these. Yeah, it's like each of these organizations represent many other, you would say, country level organizations within them, and together they have all come together into this larger platform that you have called the AIOT.
Yes.
Okay.
Only CICOT has individual membership within these organizations, and it has members from all over the world, but it has weak link with the national societies. So the connection between the national societies and CICOT is not strong as the others.
So each one, but together, everyone is working right now to sort of create a very broad membership, but more importantly, a very broad leadership panel that is going to be hopefully collaborating, I presume is the reason for the AIOT. Maybe you can give more details.
Yes, actually, we established this organization, this alliance, as a platform to facilitate communication and to increase the collaboration between the leading organizations of orthopedics and traumatology. Of course, there may be some other organizations. Why these 5? If you look at the situation in the world, we have, for example, ASEAN Orthopedic Association in Asia Pacific. They have 8 member countries, but all of these countries are represented well in APOA. And in Europe, we have NOF, Nordic Orthopedic Federation, but they have also 8 member countries represented in EFORT. And a similar situation is also there for Mediterranean Orthopedic Federation. They are represented in the others. So we choose that 5.
So so if I'm correct, then what you're saying is, yes, there may be many other organizations that fill the fulfillment of being an organization that works with other smaller organizations, but the reason you chose the 5 you did was because they developed all of them. So even some of the smaller ones, for example, they would also be included. So they're not being excluded per se. It sounds like they're being included in the larger overall vision of the group. Okay, that's great.
Yes, you are completely right. In the beginning, first start with a memorandum of understanding between APOA and EFORT, and there was also some agreements between some of these societies to have some common educational programs. But the first memorandum of understanding was between APOA and EFORT. And then in 2018, during the EFORT Barcelona Congress, the leaders of these organizations came together, and then they decided to establish that alliance as a platform, and a memorandum of understanding between these five was signed. And then we had another meeting during Lisbon Congress in 2019, and we were supposed to have our larger meeting, let's say, this month in Antalya, in our first scientific meeting. It was supposed to be an orthopedic trauma course, but unfortunately this COVID-19 situation blocked it, and we postponed it.
So, but it does, in a positive way, have gotten you to think together about what you can be doing for COVID. And you know, what I've had the privilege of being involved in with you recently has been your work together to put together what you will be releasing, I believe, very soon, if not today, based on the timing of this video, a sort of a best practices platform statement from the AIoT, which is actually a fairly significant accomplishment from the group, given the fact that it represents hundreds of thousands of surgeons who work across many countries, hundreds of countries. So it's a very unifying and important statement, and getting so many leaders together to do this, I think, is almost, quite frankly, unprecedented in this time. Can you speak a little bit to how the process of this best practices document came up?
Let me start from this. Why do we need an alliance? The basic idea was to have a platform to collaborate better, and this COVID-19 joint statement is maybe the best way of collaboration. And when we were having our Zoom meeting with the leaders of the group after that COVID-19 outbreak began, we decided to have a joint statement. And of course, we wanted to have some key recommendations to the global orthopedics and traumatology community, which can guide them in general, which can guide them in their outpatient and outpatient care and elective procedures management, and also which can guide them in emergency procedures and risk mitigation strategies. That was the idea, and the group was positive about it. And then with the document which was created by Orthopaedics, we also worked on that, and the document, the joint statement, was created, and hopefully it will be featured on the websites of each 5 orthopedic and traumatology organizations next week.
You know, things are changing so rapidly, Onder, that, you know, how do you plan as an alliance to broadly think about, you know, helping the other associations, the other societies, as well as the member surgeons around the world as they think through COVID? What are some of the big tasks of this alliance that you're hoping that they can do together?
Yeah, you know, it's not only for that COVID thing, but it is by providing a platform, a common platform, it can help us to provide unity, to be stronger in a global level. It can help us to be more influential by having a unified voice in our relationship with the industry, in our relationship with the decision makers. And we need that alliance also to comply better with the changing environment of training. We are seeing it now in that during these COVID days, and also in the changing environment of our daily professional practice. It can help us to be able to use the global sources in a more rational way in training, in daily professional practice, let's say. Actually, it can help us to be able to see the big picture, and we can take the advantage of the sharing the experiences of other organizations, other regions, for better governance and for better service. We can avoid duplications. That was the idea behind creating that platform.
What type of impact do you hope this particular document might be able to make for surgeons who are currently, in many ways, looking for evidence as they try to maneuver through what is currently this pandemic COVID-19?
Yeah, we are living in a global world now, but we have our regional circumstances, and this document tried to guide us in general. I mean, we can have our specific situations, but I think this short document covers the main issues. And while we are practicing, while we are trying to help our patients, I think if we can take these points into consideration, we can be more helpful to the people. And you know, this kind of global, let's say, collaboration is very important, because with this COVID-19 outbreak, we see that actually we are living in the same world, and we should have standards in every country. When such an outbreak starts, we should stop it in that region, and this requires a certain level of health care system in every country. So the developed countries should help developing countries to have better health systems, because COVID doesn't recognize the borders or any other possible future microorganism or situation will not recognize borders. So we are living in the same world.
Thank you very much again, Onder, and thank you so much for representing what to me is an unprecedented alliance and an unprecedented collaborative effort by the AIoT. Thank you.